Dr. Sunil Kapade from the Ministry of Health, Dr. Soumya Swaminathan, the Deputy Director General, Dr. Renu Swaroop, the Senior Advisor of the Department of Biotechnology, Dr. Richard White from the London School of Hygiene, Blessy Kumar, great talk that you just also had, Daniel, Nick Drager. I would like also to recognize Lucita over there. Colleagues, ladies and gentlemen, good morning. It's a great pleasure for me to be over here. And it's also a great pleasure to see you here in India. A lot of things are happening globally on tuberculosis, but also a lot of things are happening here in India. So in that sense, I think it's really right that you're over here. Globally, I think you have already heard from the General Assembly. We're getting ourselves prepared. And we had a great meeting also in Moscow. And I think everybody is now understanding that we need to do more about tuberculosis. In India, something similar happened. I think 2 years ago, I saw the movement coming where at a certain moment India started looking very critical at where it was and started saying we need to do more and better. And I was very proud of His Excellency the Minister J.P. Nada when we were together there in Moscow, when he not only said that we have now a very innovative and ambitious plan, but we have the full commitment of the India government to fund it. I can tell you when he said that there will be $2 to $3 billion available for the next 2 or 3 years in India to fight tuberculosis, there was a big applause. So once again, I think we're very happy that you're all over here, and it's very right you're over here while TB is getting globally the right attention. Now, my speech is made a lot more easy. The two ladies who have spoken, I think, wonderful. Dr. Soumya and Blessy, I think you've taken half of my notes. So in that sense, I think it should be shorter. But some people know me, I will get also passionate about it. Now, the numbers you already have heard. TB is indeed, it's a disease, it's an infectious disease, and most of the deaths from infectious disease is coming from tuberculosis. But it's also a very special disease. You know, some of the diseases, sometimes you have it and you don't have it, and that's it. But something that has not yet been mentioned, that 1/4 of the population has latent TB. Somewhere a TB bacilla is in his body. Most likely I'm one of them. I treated TB patients when I was in Africa, and for sure I was very intense in that part. I'm most likely one of them. And that's also one part what we need to think about. If you really want to get rid of a disease, and 1/4 of the population is running around with some of these bacilli, then I think we have a real challenge also at hand. And that is something what we need to realize. And as the scientists over here know, that 10% of those with those TB bacilli will also start developing TB. Now, it is also true if you look at some of the strategies, either way globally, by ending it by 2035, either way by some countries by 2030, and India in 2025, the decline cannot be done with the current tools. More needs to be done. And I think that is something which I think both Dr. Soumya and Blessy has already been mentioning it. But it's not something very small. If you look at the figures, and I think your prediction was in 150 years, we might be getting there if we continue like we're doing now. Now, I think most of us, we can't wait. And I think we cannot wait. If we know that there are tools, then we need to make sure that all the tools are on the table and also that they are properly applied. So that's the challenge, I think, for us at this very moment. Now, here in this region, there were at a certain moment 11 health ministers who started also saying we need to do more. And they called it bending the curve. And it implies that the curve, the way it's going, is not good enough. We need to do a little bit more. Now, the tools that we have, the new diagnostics, for sure, some of the new diagnostics are already in place and helping us an awful lot. The new drugs keeps on being very important. Shorter treatment regimens are very important. I think we're still a little bit slow on the latent TB strategy. I think we need still to do a little bit more in this area if we really want to bend that curve and get further. But a vaccine is extremely important. And there's nothing better. I think if you look at WHO as well, prevention is the best. I think, Blessy, you said also in a different way, prevention remains the best. And I think this is something which I think we need to far much more look at. I would argue that TB vaccine is at this very moment an unmet global public health need. A TB vaccine is a global public health good. And what does this mean if it is a global public health good? It means that we all need to get involved in making it develop. It means that also government needs to start investing. Because if you need a global public health good only to the industry, that's not fair. That's not even fair for the industry. But it's also not fair if anything would come from it, then who can benefit from it? So we really need to be there, and we need to make sure that we are investing also governments in this area. Because whatever comes from it, we need it all. And think again about all those people with latent TB, etc. And this is not a small population size, as I just mentioned, 1/4 of the global population. One thing before I forget, I would also like really to agree with what Bless is saying. We're talking about these tools, but one very important tool, when you try to eliminate any disease, you cannot do it without the community. If you do not get the involvement from the community, from the children, from the mothers and the fathers, from the community leaders, you will fail. So let's also put this one as the other, a very important tool to move towards elimination. So I would like just to acknowledge it before I start only talking about the vaccines alone. Now, in India, at this very moment, what you will learn is, I think somebody was just texting me that some new research also came out, and I think it looks again very promising. But it is also true what Blessy has been saying from how much is actually being invested in TB vaccine. From my figures, and I think most of you know even more, I understand there was only $81 million being invested in the TB vaccine. That looks a lot. But do you know how much is being invested in HIV/AIDS? 10 times more. Now, they're all very important, but it's also true that if you really want to make a dent and make a change, I think we need to have a greater investment in TB vaccines. And again, I do think that at a certain moment, those people need to start chipping in order also to make sure whatever comes out of it, that it can be accessible and affordable to all. In India, there will also be a research, there's a new vaccine trial, will soon be starting here in India. And in that sense, I think we need also to recognize the TB Research Consortium, where I think Dr. Somya, with a lot of passion, has been working on. And I think it is still there. And I think it is very important that India is also committing themselves strongly in this area. So what we as also as WHO would like to argue for, that we do believe that this is a global public health good. It is an area where as WHO we do think that we need to come all together and make sure whatever evidence, whatever is there, that it needs to be shared widely in order to go faster. Because we cannot have that somebody would like to sit on it forever and then at the last, and then 5 years later comes up with it. I think that information needs to be shared early to make sure that we all can benefit, because we need to accelerate the process, the progress and the process itself. So again, I think glad that you're also over here, and I'm very glad also that we are putting attention to this. We cannot bend that curve. We cannot end TB by the dates that we have set without also looking into the TB vaccines. So thank you very much.